Hello there, YouTube. This is Dr. Carlo Ojet. I'm a board-certified emergency physician and the founder of DrER.tv. This will be the first of many videos on how to interpret radiographs. We're going to start with the chest x-ray. And the chest x-ray is a very common x-ray done for almost everything. And there is an approach on how you're going to look at a chest x-ray. So I hope you enjoy this video and I hope it's of great value to you. First, you're going to do an initial overall review. Is this a grossly normal or grossly abnormal x-ray? Is there a knife or any other foreign body sticking out somewhere in that picture? Is there a large heart? Is there a collapsed lung? Is there pneumonia or a wide mediastinum? So you want to be able to tell if it's grossly normal or grossly abnormal. And then you're going to go to a systematic approach and you're going to pry. PRI. PRI stands for penetration, rotation, and inspiration. And that's just a judgment of how adequate was this film. So the first one is penetration. Penetration is judged by the ability to see the lower vertebral bodies. You should be able to faintly see these vertebral bodies behind the heart. If you see too much of them, then the film is too much penetrated. And if you see too little of them, means the x-rays didn't quite go through, so the penetration was not sufficient. So enough or too much penetration is judged by the vertebral bodies. Rotation. Rotation refers to the patient was like more on the left, more on the right, if he was crooked when they took the x-ray. So you should be able to see the mid-clavicular heads align with the tips of the spinous process. So this is right here, spinous process, and you got the clavicular line here and here. So those lines should align with the spinous process here. So sometimes you can see that this line, it's here and this one's here. So it's rotated towards the right and so on. So the next thing is inspiration. You want to make sure that this patient was taking a deep enough breath. That's why when we go to shoot this x-ray, we tell a patient, take a deep breath and hold it so that the lungs can inspire and fill up with air all the way down and make the heart be more visible, be pushed down. When people do not have a good inspiration, then the diaphragm will be here. The heart will be kind of like jumbled up and it will look big. It will look like the patient has cardiomegaly when in fact they do not. So you want to make sure it's a good inspired film. So how do you know that? Well, you should be able to see about total of 10 or 11 ribs would be better. So if you count them out, you got rib number 1, you got rib number 2, you got rib number 3, and then it's easy from there on. 4, 5, 6, 7, 8, 9, 10, and you can see the beginning of the 11th rib right here. So this is a properly inspired x-ray. So PRI, penetration, rotation, and inspiration. Penetration, rotation, and inspiration gives you how adequate the film is. The other thing is bones. You should be able to see the ribs. You should be able to see shoulders and vertebral column. So shoulders here, a little bit of them anyway. And the lung, you should be seeing that the lungs are symmetric. You can see the angle. So here you kind of lose that angle. So it should have caught, because what if there's something right there and you miss a little pleural effusion, a tiny little pneumonia or something. So you want to make sure all the angles of the lungs are visualized. You can follow these lines all the way through. All right, so let me erase all this stuff. All right, so compare lung markings. You should go from right to left. So you look over here and you compare to here. You look over here, you compare to here. It should look symmetric left and right. Any asymmetry should be considered an abnormality. Then you want to look at the central zone. That is the heart, the mediastinum, which is the medium part of the chest, the trachea. You want to look at the hilum, which is right over here, and of course the vertebral column, which you already talked about that. And you want to look at the zones, the lungs, and the periphery. You also want to look at the bones here and here. You don't want to miss stuff in the soft tissue. You don't want to miss stuff over here, which could be subcutaneous air or something like that. So we talked about the initial overall review of the x-ray. Then we talk about how adequate the x-ray is. And then we do a targeted approach. So pattern recognition. So again, does this patient have pneumonia? Does this patient have heart failure? Does it look hazy? Does it have peribronchial coughing? And these are patterns you will learn over time. So don't expect to know them right away. And this is something we will discuss on future videos of how to interpret radiographs. And then finally, diagnosis. You should definitely be looking at every x-ray and really zooming in, especially over here, to make sure you don't miss a pneumothorax, which would be a very faint line there. I mean, large pneumothorax would be like that, but sometimes they're tiny and they're up here. So you gotta make sure you look at those very well in very good detail. And that's it. So initial overall review, systematic approach, and lastly, a targeted approach to chest radiograph interpretation. I hope you enjoy this video.